For over 3 decades, the ideal of delivering the best possible health care to the people has served as the inspiration behind the founding and growth of the Dagupan Doctors Villaflor Memorial Hospital.
The idea of having a hospital came up to my father. So we had an old building in Arellano near the Pangasinan Provincial Hospital, and we converted that into a 17-bed hospital in 1968. It was called Dr. V.V. Villaflor Clinic and Hospital. So we managed that hospital for 12 years. My father, me, Doctora. My mother was the pharmacist.
In stages, it has expanded to provide more and more services needed by an ever-growing population.
And then in 1980, we transferred to Mayumbo, the old hospital. It was a 3-story building, and from that, it grew to the 4-story building in 1986, and then added another wing, Medical Arts Tower, in 1996.
From figment of an ideal to today's continuing cause of saving lives and improving people's quality of life, the Dagupan Doctors Villaflor Memorial Hospital's growth has brought along with it the tools of modernization and houses the expertise of its committed band of doctors and paramedical professionals. Under the leadership of Dr. Viven Villaflor, the hospital and staff have realized advocacies that are fueled by a deep sense of humanity in a profession which often requires personal distance and calculating objectivity. In recognition of his professionalism and of the lives he has touched, Dr. Viven Villaflor has time and again been honored by a number of the country's respectable organizations. For this year, 2010, the Dagupan Doctors Villaflor Cancer Institute is the Dagupan Doctors Villaflor Memorial Hospital's latest annex. It is a testament of the hospital's management's advocacy of better healthcare services for all. As a building structure, the Dagupan Doctors Villaflor Cancer Institute has been designed to ensure safety, conservation of power and resources, vital backup systems, and the latest monitoring and surveillance systems. As a fully equipped facility, the Dagupan Doctors Villaflor Cancer Institute is a broad-spectrum medical service facility. In addition, it stands unique in Northern Luzon for its array of logistic resources that enable the hospital to provide holistic solution to cancer treatment. Among its key resources for cancer detection and therapy, the Institute has a linear accelerator, CT scan, gamma camera, ultrasound, mammogram, colposcopy, cryotherapy equipment, and tissue pathology laboratory.
Our goal is to be able to treat cancer holistically in one setting, so everything is within reach. When you need a certain specialty or a certain laboratory test or treatment, it is housed in one building.
The Tissue Pathology Laboratory is an add-on feature of the Institute. It enables the hospital to conduct in-house tissue analysis. Previously, such service had to be outsourced to laboratories based in Manila. This entailed delay in the time it takes to make a diagnosis and in the processing of subsequent follow-ups when necessary. The centerpiece of the Dagupan Doctors Villaflor Cancer Institute is its linear accelerator. It is a new age technology that has replaced the cobalt radiation equipment, which possesses the disadvantage of exposing patients and radiologists to levels of radiation that is higher than what is ideal. Radiation therapy via linear accelerator is target-specific. It delivers precisely measured radiation emissions to targeted cancer tissues. To the patient, this means reduced exposure and damage accounted to stray radiation emissions. To the doctors, radiologists, and to the hospital environment, it means zero radiation contamination. Utilizing the combined capabilities of the advanced precision software of the linear accelerator with a CT scan to locate cancer tissues or gamma camera to map the location of metastasized cancer tissues. Healthy tissues surrounding the cancer are identified and spared from radiation bombardment during the therapy. Prior to the Dagupan Doctors Villaflor Cancer Institute, the advantage of linear accelerator therapy could only be availed from hospitals based in Manila. This, therefore, is a first in Northern Luzon, one that brings cutting-edge cancer therapy technology closer to home.